Okay, quick disclaimer before you watch this video. I do support medical intervention in the case of an emergency when it's life-saving. That's why they are there. But I don't think they are necessary in a majority of normal, uncomplicated births. So that's kind of what I'm talking about when these interventions are just put in place because it's protocol and not because it's necessary. So keep that in mind as you're watching this. And this is piggybacking off the post I just did. So if you didn't see that post, go back and read it. And it kind of chronicles what can happen in a hospital birth if you are not prepared. If you didn't write a birth plan, if you didn't take a childbirth class outside of what your hospital offers, if you didn't research your options, these things can easily become part of your birth, even though they are not needed, they are not evidence-based, and you would go on to have a normal birth without them. Okay, first things first, mom's water break, she goes right in, and that starts the time clock. A lot of women, when their water breaks, they're put on like a 12 or 24-hour, baby needs to be out. And evidence shows that there is, as long as there is no risk of infection, there's no meconium, there's no fever, there's no reason that mom can't labor for more than 24 hours with her waters broken. Next thing that generally happens as soon as you get to the hospital is a cervical check. There are no benefits to frequent cervical checks. In fact, the more cervical vaginal, the more cervical checks, the more risk of infection. Bacteria, even with a gloved hand, is being pushed up the vagina to the cervix. And there's more bacteria present each time with each additional cervical check. So why do we check the cervix? Your body will tell you when you're ready to push the baby out. But again, hospitals are very much on a time clock and they want to know exactly how long labor is progressing. Getting IV fluids as soon as you get to the hospital. Drinking and eating by mouth is sufficient. You don't need IV fluids. Actually increase swelling in the mother, which can actually make breastfeeding more uncomfortable. And it also can cause an artificial weight drop in the baby, which they are swollen too. And then they lose those excess fluids. And now the hospital is concerned that the baby's dropped too much weight and now they want to push formula. This is how that cascade of interventions goes down. Not being able to eat or drink during labor. It is completely safe to eat and drink during labor if the laboring person wants to. In fact, it can give you more energy for labor and delivery if you are eating and drinking. And also you won't need the IV fluids if you can drink. Labor that's not progressing. That labor in my post, that example, it was progressing. First time moms can be in early labor for 17, 20 hours. And that's not uncommon and nothing is wrong. That is totally normal. So knowing that, especially for first time moms, that labor can take a long time, especially if you got to the hospital before labor started, you're gonna be laboring for a while. Know that that's normal and there's no need to rush what is physiologically normal for your body. Being told to stay in bed while you're in labor is actually very, very harmful. Being restricted to bed leads to longer labor. Remember, we were already concerned with how long labor was taking, but when you have to stay in bed, it's gonna take even longer, and more uncomfortable and painful labors. Staying in bed also increases your risk of needing Pitocin, an epidural, a C-section. Sometimes the reasoning for staying in bed is the risk of cord prolapse when your water has broken. There's no evidence that shows that when water breaks before labor starts, that will increase your chance of cord prolapse. So there's no need to stay in that bed. Pitocin is effective. It can reduce your labor on average by 2 hours, but getting up and moving around, bouncing on my birth ball right now, being on a birth ball can decrease labor on average by 1.5 hours without any harmful side effects or without triggering that cascade of interventions. Being on Pitocin does not increase your need for a C-section, but it also doesn't reduce it. And movement in the birth ball actually reduces your chance of needing a cesarean section. A lot of times once women start the Pitocin, their contractions get too intense and too close together to manage, and they want the epidural. Now, Pitocin is a synthetic oxytocin. Your normal body's oxytocin produces contractions in a way that is going to be more manageable. So it's very likely when women get Pitocin that they're going to ask for an epidural. And while the epidural is great for relieving pain and it is great for letting mothers get some rest, it's not without side effect. Epidurals can cause fever in the mother, which now we're concerned about infection. Now we need to get that baby out. It can cause trouble urinating. You might need a catheter, more interventions. It can also drop mom's blood pressure, which is going to affect the baby's heart rate. And some other side effects are just not having control of your body. Sometimes it can give you a motor block where you literally cannot move from the waist down. And this can sometimes make pushing a little more difficult for moms. Movement and hydrotherapy are two options for pain management that have been shown to be just as effective as an epidural without increasing any risk for cesarean, without any side effects that an epidural or other pharmaceutical pain management options would have. Part of the problem is those other pain management methods are not offered. What's offered first in the hospital is the narcotics or the epidural, the fentanyl, versus maybe acupressure or hydrotherapy or massage. Continuous fetal monitoring. As soon as you get to that hospital, they want to hook you up with the bands that measure your contractions and also measures baby's heart. This one, really common. They even have the mobile one, so it's supposed to be like, oh, it's fine, you can get up and walk around, but they are uncomfortable. You're still having to walk around with your monitor. It's not actually super accurate. There's no evidence that shows that there is a decrease in the risk of fetal death with continuous monitoring versus intermittent monitoring. It's actually more evidence-based for your provider to check baby's heart rate using like a handheld Doppler at intermittent intervals. And it allows mom more freedom of movement, which we now know movement, getting up and moving around, is gonna shorten your labor and provide some pain relief. A couple of things to talk about when we're talking about pushing. Pushing can take more than an hour for a first-time mom. Again, we shouldn't be putting this timestamp on labor and birth. Also, there's no evidence that shows that there's a benefit of coached pushing versus like mother-directed instinctual pushing. Also, lying on your back is the absolute worst position to push in. It doesn't allow your sacrum to expand, which is gonna make it more difficult for mom and baby to get through the birth canal. Gravity, having gravity work with you with pushing is your best bet. And if you have an epidural, sideline pushing to give that your tailbone that freedom of movement is much better than lying on your back, or even like a semi-reclined where you're still pressing on your tailbone. Cord clamping. Typically, well, let's talk about clamp versus cut. Once you clamp it, blood supply is cut off between the baby and the placenta. Usually they clamp it first and then maybe cut a minute, 2 minutes later. Typically, the cord is clamped within the first 30 to 60 seconds. And in that time span, the baby's only getting 70% of its blood from the placenta. Versus if you leave the cord unclamped, so delayed cord clamping, 3 to 5 minutes, baby's getting 87% of that blood. So really longer than 5 minutes would be the most beneficial. Make sure you are very clear in what you mean by delayed. I don't want delayed to be 2 minutes. I want it to be more than 5 minutes, or I want to wait till the placenta is delivered until you clamp and cut. Last one, okay, Booney? Okay. Skin to skin. So skin to skin should be immediate. All those, the baby's weight can wait. The vernix is actually really beneficial to the baby. Baby doesn't need to be wiped off. Skin to skin should be the first 1 to 2 hours, uninterrupted, of baby directly on mom's skin, not a towel in between, not a gown in between. Immediate skin to skin promotes healthy breastfeeding, and it promotes bonding. Mothers who are separated from their baby are actually less responsive to their baby's cues. So there's a lot of biology coming into play here. It also helps stabilize baby's vitals to have that skin to skin time right away. Well, Millie, your baby's ready to pop. It's the size of a watermelon. She's obsessed with the food sizes of the baby right now. All right, I really only touched on the surface of some of the reasons why these protocols, we shouldn't be doing them. I mean, each one could really be its own 10, 15 minute informational video. But I just am hoping that this is eye-opening and will encourage you, if you're giving birth in a hospital, to write a birth plan and do a little research and take a childbirth class that is not just your hospital's childbirth class. Specifically, if you want an unmedicated childbirth, you should look for a childbirth class that's going to prep you for that. And this is a big reason why I'm creating a childbirth class specifically for those parents, those birthing people that want an unmedicated experience in the hospital where these protocols are just boom, boom, boom. Another thing to know, anytime mom is uncomfortable or interrupted, so by all of these protocols and interventions that are happening as standard procedure, these are all interruptions to the mom's physiological hormone response to birth. Every interruption, everything that is uncomfortable to the birthing person is actually, upping the birthing person's adrenaline, which can slow or sometimes even stop, reverse labor progress.
Bye.
Bye. Say